Picture this, you're 45, successful, but you keep losing your keys. Exhausted by 3 p.m., zero interest in intimacy. Is this just aging, or is there more to the story? Your doctor says it's just aging. But what if I told you that 5 million American men are suffering from something that's rarely talked about, often misdiagnosed, and completely treatable? Here's a shocking truth. 40% of men over 40 show significant signs of male menopause. But most never even hear about it. Are you one of them? While women get support and understanding during menopause, men are told to man up and just deal with it. Today, let's break this silence and explore what male menopause really is and why it could be the missing piece to your health puzzle. Stick around while I walk you through testing, lifestyle changes that work, and treatment options. Unlike the Hollywood jokes, male menopause isn't about a midlife crisis or sports cars. It's a real medical condition where testosterone levels drop gradually. About 1% in total testosterone and 2 to 3% of free testosterone every year starting in your late 30s to early 40s. By age 60, 20% of men have low testosterone. By age 70, that number jumps to 30%, and by age 80, half of all men have measurably low levels. But here's what makes it tricky. It's not sudden like female menopause. It's slow, sneaky, and often blamed on just getting older. The medical term is late onset hypogonadism, and it affects everything from your energy to your heart health. Could that stubborn belly fat or unexplained fatigue actually be a warning sign? Most men wait years before ever getting diagnosed. Let me paint you a picture of what male menopause actually looks like. Crushing fatigue that sleep doesn't fix. Muscle turning to fat, especially around your belly. Erectile dysfunction and decreased sex drive. Hot flashes? Yes, men get them too. You can check out my video here. Man boobs, which is gynecomastia, and smaller testicles. And bone loss that increases your fracture risk. Here's a problem. These symptoms develop so slowly that most men and their doctors miss them. Studies show that hypogonadism is vastly underdiagnosed, with only about 5% of men with low testosterone actually receiving treatment. The average man waits years before getting properly diagnosed. Meanwhile, these aren't just inconveniences, they're warning signs of serious health problems brewing under the surface. Did you know that the very things we do every day, stress, lack of sleep, drinking habits, could be quietly sabotaging your testosterone? It's not just biology causing these problems. Modern life is testosterone's enemy. Chronic work stress increases cortisol, which directly suppresses testosterone production. Sleep deprivation from our always-on culture crushes hormone production. Relationship problems, divorce, and financial stress can worsen symptoms or mimic low testosterone. Many men who drink alcohol don't recognize that it seems designed to undermine your testosterone levels. Drinking culture hurts you in a lot more ways than putting a few extra pounds on. Check the description to see all the related videos on these topics. The midlife crisis phenomenon isn't just psychological, it's often hormonal. The solution isn't just medical, it's lifestyle. That's a real story here in the philosophical approach of Bespoke Concierge MD. Men who address both the hormonal and lifestyle aspects see the best results. Stress management through meditation, yoga, or counseling can significantly improve testosterone levels naturally. Before you rush into testosterone therapy, what does the largest clinical trial ever actually say? And what risk could you be missing? If you're thinking, should I get testosterone therapy? Slow down. The Traverse trial was conducted with over 5,000 men, and it found some important results that every man should know. First, the reassuring news. Testosterone therapy doesn't increase heart attack or stroke risk as previously feared. It can improve energy, mood, muscle mass, and sexual function. There was no increase in major adverse cardiovascular events during the study period. Now, the 5 major concerning findings. 1, higher rates of blood clots in the lungs, which is called a pulmonary embolism and can be fatal. 2, an increased risk of atrial fibrillation, which is an irregular heartbeat. 3, more cases of acute kidney injury. 4, it can shut down your body's natural sperm production. And 5, it's not safe for men with prostate cancer or severe heart conditions. The FDA requires testosterone therapy only for men with confirmed medical causes of low testosterone, not just aging. Most doctors recommend trying lifestyle changes first, and the long-term effects beyond the study period is still being researched. Check out my detailed breakdown of the risks and benefits of getting testosterone replacement therapy here. Here's something that might shock you. If you have diabetes, you're twice as likely to have low testosterone. And if you're struggling with obesity, your risk of testosterone deficiency jumps by a staggering 240%. This isn't just coincidence. There's a dangerous relationship between chronic illness and male menopause that most men never see coming. The numbers tell a troubling story. Heart disease, diabetes, and high blood pressure don't just happen alongside low testosterone, they actually accelerate its decline. In fact, up to 80% of men dealing with chronic diseases also have testosterone deficiency, creating what doctors call a vicious cycle. Here's how it works. Low testosterone makes you more vulnerable to developing chronic diseases like diabetes and heart problems. But then those very same diseases turn around and suppress your testosterone production even further. It's like being caught in quicksand. The more you struggle with one problem, the deeper you sink in the others. The good news is that this cycle can be broken. Early intervention, catching and treating both the hormonal imbalance and underlying health conditions, can stop this downward spiral long before it takes control of your life. This is why getting tested and seeking treatment isn't just about feeling better today, it's about preventing a cascade of health problems that could define your future. Check out the description to find links to each of my videos on these specific topics. So, should you get tested? If you have multiple symptoms, absolutely. Is your one-off lab result really telling the whole story? I screen every male patient annually after 35 in my practice. Here's what you need to know. The most accurate blood test for testosterone should be done early in the morning if you're under 45, or before 2 p.m. if you're older, since hormone levels naturally fluctuate throughout the day. For the best results, skip breakfast and go in fasting. You should also get tested more than once for confirmation. Up to 30% of men who get a low reading the first time see normal results on follow-up tests. Generally, healthy testosterone levels fall between 300 and 1,000 nanograms per deciliter, with most experts considering 400 to 700 as an optimal range. If your levels consistently fall below 300, that's a clear sign of deficiency. If you're in the 300 to 400 range, your doctor should weigh your symptoms and overall health to decide the best course forward. Getting the right diagnosis isn't just about a single lab result. It's about understanding your body's signals and working closely with a professional to restore your vitality. Now, imagine waking up day after day feeling drained, mentally exhausted before the day's even begun. You're trudging through work, snapping at family over things that never bothered you before, and starting to wonder if the old spark will ever return. This is what male menopause can feel like when it's ignored or undiagnosed. At first, it's a string of frustrating days, unrelenting fatigue, a mood that just won't lift, and relationships that start to fray under the pressure. Work performance drops, motivation slips away, and life seems less fulfilling. But the impact doesn't stop there. Over time, untreated low testosterone can quietly wreak havoc throughout the body. The risk of heart disease and stroke rises, and for some, diabetes and other metabolic problems begin to appear. Bones become weaker, quietly increasing the risk for osteoporosis and even fractures, a threat that most men barely see coming until it actually happens. The statistics are sobering. Men who ignore the symptoms or whose testosterone deficiency goes untreated face a higher risk of dying from all causes compared to those who get help. Memory begins to slip, and cognitive changes can accelerate. For men who struggle with both low testosterone and erectile dysfunction, the danger becomes even more real, as their risk of dying from cardiovascular disease climbs significantly. Male menopause isn't just about feeling tired or losing your sense of drive. If left untreated, it puts your long-term health and even your survival on the line. This is why recognizing the symptoms and seeking the right treatment matters, not just for better days, but for all the days ahead. Don't just do it for yourself, do it for your family. Here's the good news that might surprise you. You don't always need medication to feel like yourself again. Many men see dramatic improvements in their symptoms through simple lifestyle changes that work with the body's natural hormone production. Let's start with movement. Your muscles are like testosterone factories, and strength training is the most powerful tool you have to boost your hormone levels naturally. Just lifting weights 3 times a week can increase your testosterone by 15 to 20%. But here's what's really exciting. High intensity interval training, or HIIT, shows even better results. Think short bursts of intense exercise followed by rest periods. Even if you're not ready for intense workouts, don't worry. Moderate exercise like walking, swimming, or playing sports helps maintain muscle mass and energy levels. Now let's talk about fuel. Your testosterone is literally built from the food you eat. So what goes on your plate matters more than you might think. A Mediterranean style diet works like magic for hormone health. Think lean proteins like fish and chicken, healthy fats from olive oil and nuts, and plenty of colorful vegetables. Your body craves this real food. Meanwhile, processed foods, sugar, and too much alcohol act like testosterone killers. So limiting these can make a huge difference. And here's a number that's easy to remember. Aim for about 0.8 to 1.2 grams of protein per kilogram of your body weight. This protein becomes the building blocks that preserves your muscle mass as you age. To get a better understanding on how food affects your health, please check out Dr. Ednie's YouTube channel. It's awesome. There are two other factors that can make or break everything else you're doing. Sleep is where the magic happens, literally. Your body produces most of its testosterone while you sleep. So those 7 to 9 hours aren't just rest, they're hormone therapy. Poor sleep can cut your testosterone production in half. So this isn't optional if you want to feel better. The final piece is stress management. Chronic stress floods your system with cortisol, which directly blocks testosterone production. Finding ways to manage stress, whether through meditation, yoga, time in nature, or even just talking to a friend, can naturally boost your hormone levels. And here's something that might motivate you. Even losing just 5 to 10% of your body weight can dramatically improve your hormone levels. Why? Because fat tissue produces something called sex hormone binding globulin, or SHBG, which literally soaks up your available testosterone like a sponge. When you lose weight, you free up that trapped testosterone and release it back into your bloodstream where it can actually do its job. The beautiful thing about these changes is they don't just help with male menopause symptoms, they're like a full body upgrade. Better health, sharper brain function, more energy, better mood. Your whole system starts working better when you give it what it needs. Men who get proper treatment report feeling like themselves again, with energy, motivation, and vitality restored. But here's what most guys don't realize. Getting the right treatment is like putting together pieces of a puzzle, and every man's puzzle looks different. The journey usually starts with the fundamentals. Most good doctors won't jump straight to hormone therapy. Instead, they'll work with you on the lifestyle changes I just outlined. It sounds simple, but for many men, especially those whose testosterone hasn't completely crashed, these changes can be absolutely life-changing. Think of it as giving your body the best possible chance to heal itself first. But when lifestyle changes aren't enough, that's where modern medicine becomes your ally. Testosterone replacement therapy has come a long way from the old days of painful shots and unpredictable results. Today, you have options that fit into your real life. The most popular choice is topical gels or creams. You simply apply them to your shoulders or arms each morning, and your body absorbs a steady dose throughout the day. No needles, no appointments, just part of your daily routine, like brushing your teeth. Most men love the consistency and convenience, though you do need to be careful about skin contact with family members until it's fully absorbed. For men who prefer a set it and forget it approach, injections might be the answer. These are typically given weekly or every 2 weeks, either at a clinic or once you're trained in the comfort of your own home. They're highly effective and often the most cost-effective options. Some men actually prefer the ritual of their weekly injection because it makes them feel like they're actively involved in their health. Then there are some newer options that work differently altogether. Instead of replacing testosterone directly, medications like clomiphene or Clomid actually wake up your body's own testosterone production. This is especially appealing for younger men or those hoping to start families, since it preserves natural fertility. Here's what's really important to understand. Good treatment is never just about the medication. The doctors who get the best results are the ones who monitor everything: your energy levels, your sleep quality, your blood markers, your mood, even your relationships. They're watching for improvements in how you feel, not just what your lab numbers say. The transformation doesn't happen overnight, but when it works, men describe it as getting their life back. They wake up refreshed instead of exhausted. They feel motivated to tackle projects they've been putting off for years. Their relationships improve because they're present and engaged again. They rediscover the confidence and drive that made them who they are. The key is finding the right partner for this journey. You want someone who understands that male hormonal health isn't one size fits all. Someone who listens to your specific concerns and goals, and someone who has the experience to adjust your treatment as your body responds and changes. You are welcome to join my practice at Bespoke Concierge MD. We're here to help nationwide, offering personalized hormone optimization programs that treat you as an individual, not just a number. We understand that reclaiming your energy, confidence, and quality of life isn't just about prescribing testosterone. It's about creating a comprehensive plan that fits your life, your goals, and your unique situation. Don't waste another week feeling unsure. Take action and see the options that are waiting for you. Thanks for watching. If this information helped you or someone you know, please share this video. Your story in the comments could help other men recognize they're not alone in this struggle. Remember, knowledge is power, and your health is worth fighting for.